Jeff, let's go back to talking about some of those brief therapies. And there are some names that I think, we don't want to get lost in all kinds of jargon and so forth. But there are certain things that are specifically recommended, for instance, for certain kinds of personality disorders, borderline personality disorder, dialectical behavioral therapy.
Right.
Give us a little rundown about what these different so-called brief psychotherapies are, and who's relevant for treatment to these, and how do you know?
Okay, well, let's start with dialectical behavior therapy. It's not always brief. It can be, but it's not always brief. But dialectical behavior therapy, big, complicated name, basically it was designed by Marshall Linehan to deal with people who are struggling with overwhelming emotions, particularly people who are struggling with borderline personality disorder. And it has four...
Because part of the... sorry for interrupting.
That's okay.
But because of part of the manifestation of borderline personality disorder is difficulty regulating the extremes of emotion, seesawing back and forth.
It's not only it's difficulty with overwhelming emotions, difficulty with your personal relationships, confused thinking, potentially dangerous behaviors. So the person is just being flooded with a tidal wave of overwhelming emotions. And before the 1980s, we didn't have too many good treatments for that particular problem. And then this particular treatment, dialectical behavior therapy, was developed, has a lot of great research to support it. And basically it comes down to, it teaches four skills groups to the person involved. It teaches distress tolerance skills to help you deal with overwhelming emotions in the moment. It teaches mindfulness skills so that you can learn how to be more present and focused in the present moment. It teaches emotional regulation skills so that you're not overwhelmed by your emotions. And it teaches interpersonal skills so that you can learn how to get what you need in a more effective way.
Sounds like it's useful for all of us.
It really is. And I'm kind of biased on this because I did write the Dialectical Behavior Skills Workbook, and we did gear it towards people dealing with a lot of problems, not just borderline personality.
Well, I'm afraid that for today we're going to have to wrap it up because we're...